This question is for you, Susanna. You mentioned that you're going to be doing some research this summer as a follow-up to your most recent publication. You said 2/3 of people who look for health information online talk to someone about it, mostly friends and family, not their doctors. Could you tell us a little bit more about the research that you're planning and what you're looking for?
Sure. So the last survey was really hoping to map for the first time the landscape of social media and health, and to ask people about what their relationships are with information. And now I want to move towards what are the personal networks that spring up when a life-changing diagnosis happens, whether that is friends and family. You know, I've heard about people using Facebook essentially as a I heard it described as a personal health record with privacy issues. That people, you know, use Facebook or MySpace or even Twitter to kind of give little quick updates. And so I'm interested in what happens when somebody has a health issue and they use the social media that's available to them. But also, so much of health happens offline, of course. And so what are the conversations that happen after you search for a treatment online and you then have a conversation with a loved one? What we didn't explore is where that conversation happened. And actually got some great feedback on Twitter last week where people said you should ask not only about, of course, phone versus online versus face-to-face, but when you're talking to people about online, is it real time? Did you have the conversation on Skype or IM? Was it delayed reaction like email or posting to a group? And so that's the research that I want to get into next. And I'd love to have conversations with people and suggestions about what other questions you guys are curious about.
I have a question about key influencers within the online social networks. So in your research, have you found any information about who are the people that are most influential? What do they look like? What do they do? How do they communicate differently than maybe some of the other people in the networks?
That's a great question. And we actually haven't yet mapped that. We haven't mapped the key influencers in health. The Pew Internet Project studies a whole range of issues, and we have looked at that in terms of news and politics and government. And so actually what I'm interested also in doing is kind of triangulating from what we know about political influencers, because of course there are key people in your network who always seem to know about that video before everybody else does, and they forward it around to everybody. And then there's the people who find out last and still forward it around to everybody. Who are the influencers who know about that stuff first? Who's reading the journals and making sure that people know about it? What do you guys think?
It's interesting, and I'm answering more anecdotally, definitely not on the way. I can't wait to see what you guys find and talk to you about it, because on behalf of clients, I've done this for over 20 different disease states. We've done it from cancer to Crohn's disease to cycling blogs, which were related to another type of topic. We've literally looked at numerous disease states to map out and identify who those key influencers are, who's talking to whom, what they're talking about, and who's influencing the conversation. And it does change with different disease states, but I would say that there are certain people. I've never looked at it in terms of how is this key influencer in breast cancer similar to the key influencer I found in Crohn's disease. We often look at it in terms of how do the key influencers impact the conversation in Crohn's disease versus how they impacted in a similar disease. And what we do is we map them out and look at their blogs and look at their Facebook pages as if these things are available, and just see what they're talking about and how we can engage in the conversation. But I've never actually looked at them in terms of how do they seem similar to each other. I've only looked at them in terms of what are they talking about, and would they be open to me talking with them. So it'll be interesting.
And I think it can change too.
Yeah.
Something that I've seen is that a life-changing diagnosis can be a trigger for different kinds of actions. And actually, I've heard somebody speak, if anybody follows Midwife Amy on Twitter, she is a midwife, obviously, and she talks about how the experience of being pregnant for the first time is a kind of one of those trigger moments that can change the way someone interacts with healthcare. And so how else can we sort of harness that energy and that sudden interest in health to create those influential networks?
I'm going to interject a question really quickly for Maya, and then we're going to go to the next person that Banks has for us. So Maya, in terms of how hospitals are using social media, do you have a sense of where things are going? Are you noticing trends? Are you noticing things that seem to be working better than others, or certain platforms that seem to be more effective? And like in 5 years, what do you think most of the hospitals in your organization are going to be doing with social media?
Well, I know that the conversation right now, and hopefully things will change in the next 5 years, a lot of us have hope, is that the main issue that hospitals struggle with is they block social media sites from computers in the hospital. So how can you ask your staff to support you online if they can't go to the nurse's station and open up Facebook real quick and write something nice that they saw? So that's something that I see changing. I see the dialogue happening, and I see communication staff asking for help in how to educate senior leadership on why these tools are important, and why, I mean, people are already using them on their phones, in their office, so why shouldn't they be allowed on their work computers? But then privacy becomes an issue. So I think across the next 5 years we'll see a lot more structured social media plans for hospitals, and definitely some changes in what's allowed. I mean, the example I gave from UCSD, I think it took one physician to say that they were going to use YouTube because it was free, and they needed to host these large videos of these major drills that are only taking place in 2 parts of the state, and a lot of people need to see these, and the free got them to allow YouTube to be accessed so that staff could learn from these videos. So I think it's just the dialogues that'll take place in the next 5 years that will shape the change.
And then from a platform perspective, are they less squirmy about YouTube from a HIPAA compliance perspective, since you get to preview the video before it goes up and that sort of thing? It's not, does that help or maybe not?
I don't know. I think what people like Ryan Squire, who I use a lot of examples from, are talking about is that, patients can say anything they want about themselves. We as hospitals can't say whatever we want about patients. So the future then is enlisting patients, on a more personal level, actively asking them to talk about their experience and things. And in terms of platform, it depends on the population that your hospital is located in and who they're trying to reach. Parkland Hospital in Texas, they've had a lot of success with MySpace and engaging teen women and soon-to-be mothers, young mothers, and sort of helping them get health checkups and things. But I don't know of another example of a public hospital using MySpace. So I think it really depends on, again, the strategy and the situation. But definitely each platform has its own successes for the specific populations.